Kalebo unaweza pata chai? Nipe chai, man.
Nitamu hivyo.
Very nice. Takuonjesha. Utaipenda. Hata wewe utafurahia. Alrighty, let me see what we got here. Hata wewe utafurahia. Very good. Karibuni, tunangoja muingie. Mwambie your brother, mwambie your sister, we is here. (254) Matatu Culture, yes, you are not late. No, you are not late. Imagine, no, you are not late. Yeah, I hope I'm not late. Ndio kuland Lois, karibu sana. Zipi pia wewe nimekucheki. All right, karibu. Kate Mwenda, nataka tu kujua venye coil inawekwa. Kate, tumia kondiko. Haya. Wewe kazana tu. Unajua coil by the way ayogopishi nini?
Ampesa kuwanaga saka kozi. Ai. Lakini kinaje kurebe. Rai anapesa pesa na vilambuka. Soma nyoko mwinde. Ai. Bwana Rai ni pombo nizo kuviranga ni pombo. Arusia mapesa kaena kushali mpuka sta. Ai. Bwana le uhore go. Mheshimiwa le uhore. Omeo yokusala. Omeo no tezanga go presori eshalo.
We Mluya kuja translate.
The biggest worry, and like from where I stand.
Translate.
Lakini shida ni moja. Omalanga wala koko ndio nomlei. Promises titie tindai nombashina. Lakini when it comes to the practicality part of it, ngolamo myondi yamalasa step mkarum.
Wanasema wewe jamaa kisha kanyaga.
Alakukalisia zone 0. Omanya fadhali lehe kubokoza kama a very good example. Waluzinji pusha chaka chaos vere myasi itu. You remember wabujirenya nonyola bana bale okuchakiramba finito lukoe. Obunyasi bakubabusiyo bunyasi paka matungu paka ena. Those are just some employments that is kuikale because now they cannot go to the nucleus. Anyway, ishingelo kubola mbu goberezo kubola ndio lane obola oborembo rai aisibu nafasi yokuzokola shina atiarane. Lakini nana my biggest worry na partner wewe uno alafuchira. Unakuwa naye umeona kesi yako seriousness, a lot of seriousness. Seriousness ni kile Even siasa ni zuma ile vitu vyozi. Ndio kuoranga vitu ni siasa. There's nothing there. It's just politics. Oparanga mbu rai la pananga rio shajenda mtsofu star. He's working. He wants to taint the name of that person. Because you see now, in fact, the first allegation was demanding 17. They didn't know. In fact,
okay, it's a long and interesting story. Yeah, so I'm on Instagram currently. I'm just looking at the Instagram for Salasia. So Salasia amepost conversion yake na Echesa. So the irony, amesave number Echesa, Honorable Rashid Echesa, ex-CS. Then so hiyo conversion venye amekuwa na unasikia venye is very civil, inaenda whatever. But kwa caption ameweka, Rashid Echesa, is it true you are a class 7 dropout? Sasa ni kiboko tu ndio unataka. Kama wewe ni mwanaume wa titit 3, si ungeendelea kuongea kwa simu. Wacha kuogopa. I told you I will give you sleepless nights with your dwarfness. Mambo ni mingi. Mambo ni most. Mbona Ainea ana flash Salasia? Si Ainea ni ule Salasia wetu. Ainea ana flash Salasia hapa mpaka karibu simu ichemuke. Oi, sasa huyu naye. Huyu anapiga na naona tuko live. Mambo gani haya? Wacha ende hapo, tuende kwa block caller. Babang. Good to go. Haya. Tuendelee, mambo ni live. Nimeshapatia uhondo ya usiku wa matisa. Sasa wacha sasa tuanze kwa kile kilichotuleta hapa. Kile ambacho mmependa, kile ambacho mmekuwa mkisubiri. That is why Masi Njoroge is here from Ruaka, Doreen yuko hapa, Masi Njoroge yako, Lilian Jalemba, Damaris Munyao, Vocho B pia yuko hapa. Shell yuko wapi? Yuko hapa. The magician is in the building, is coming up next. Tumesema tuanze na mambo ya udaktari alafu tumalize na uchawi. Kwa sababu tukianza na uchawi alafu tumalize mambo daktari, alafu daktari pia ni dem, sasa tunataka amalize alafu tumwache aende. Labda akona aende kwa mzee. Aende kwa mzee. Aende nyumbani kwake peke yake. We're just testing the waters. Yeah. So tukaona tumalize kwanza na yeye alafu akishaishia, because of the matter that we want to talk about is a bit sensitive and tunataka madem kwanza wasikize, and then ndio sawa kwa kama kulala walale, alafu tubaki sasa na wale wanasema the wicked shall no sleep. Tubaki na wale ma wicked, tufanye manini, tufanye ugangare hapa kidogo kidogo. Okay. Felix like Obinna kona simu mpya. No, hii si simu mpya bro. Yeah. Get to the program mazi. Kama wewe ni mgeni hapa useme upangwe. Okay. Watu wa Qatar karibu sana. Agneta nimekucheki. Fei, what's up? How you doing? Dana Chepchumba nimekucheki. Any advice for a young girl going through a lot of situations in life? Dana Chepchumba, I don't know which situations, because kuna watu wanasemanga they are going through a lot of stress, then unapata shida tu ni pesa. Mimi niko na depression, unapiga asikia tu ni pesa. Depression naletwanga na pesa, solution yake na kwanga ni pesa. Hiyo hata mtu kwa advice aje, you take heart, you take kidney. Depression ya pesa ni pesa. Alafu depression ya heartbreak pia inakwanga ni huyo gaidi mwenye amekuwa heartbreak. Ndiye akupigia tu simu akwambie no, it wasn't like that, I still love you, at least roho itatulia. Lakini hata mtu akwambienge aje akupikie githeri njaheo na whatever it is you like, unasikia ule mtu amekuacha na ile roho inakwanga tu iko tu hapo. Dawa inakwanga ni moja tu, okay, mbili, either umsa kupigie ama time. Utalia leo, ulie kesho kutwa, then machozi tende kishaisha pole with time. Mimi yangu ilinichukua 2 years, lakini eventually nikakuja nikahili. Yako bado inakutandika 5 years later, inakuanga hivyo. So inategemea ni mambo gani. Okay. Thank you Kate Mwende. I know they are dope I know ziko sawa. Thank you. All right. Atichela atakutoa macho 4 bila kukushika. Yeah, Shell ni ule msee. Tidawa depression ni pesa tu. No, si zote. Watu wanasemanga hivyo lakini si depression zote. Depression tofauti na ni nini may cause, but most depressions ina coming na disorder ya do. Kwanza TikTok yangu. My TikTok is crazy, man. My TikTok is crazy with the inbox and ni story za do na job. Do na job. Nini school fees, rent, chakula, hospital, nini hapo. Most inachezenga hapo. Na pia tena ukipata hiyo pesa tena realize kumbe hata shida iko ni hiyo pesa. There was another underlying issue. Alrighty. Let us begin. Karibuni sana, nipatie introduction. right, all right, all right, all right. Karibu sana. Welcome, 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 welcome. You put the wrong opening montage. This one, the one for the health. This is a health conversation. Karibu sana Obinna Show live, the health department. Yes, we decided that once in a while, every week, that is for the last 1 month, tumekuwa naleta health professional so we can talk matters health. Why? Because a healthy nation is a happy nation. We're trying to find solutions so that us young people and even the unyoung people can take care of themselves better. All right, we've had conversations with different doctors, and today we have a clinical officer from Mary Stopes, and we're going to be talking family planning. We're going to be talking the side effects. Kidogo, we're going to be talking about the hygiene. Sana sana ya mashauri. Yes, yes. Is it true that pineapple inafanya venye inafanya? Is it true that watermelon inafanya mambo inafanya? All right, then also we're going to be talking abortion. Yeah, let's talk how safe is abortion. Is it legal? Is it illegal? How does it happen? What warrants it? And stuff like that one. And most definitely, this Obinna Show Live will educate you and we get to entertain you. This one is going to be more educational, but a little bit entertaining because I'm here. So that's my job. I'm going to make you happy and I'm going to make it easier. Staki classic way too serious mpaka akina Agneta wanze kwenda ati amesema pineapple. It's going to be a bit interesting. All right. Also, we inspire and we motivate, and occasionally conversations are a little bit intriguing. Coming live to you from Samaki on Otaro. This joint is synonymous with seafood, but right now we've introduced a couple of new delicacies. Omosh, nilikutuma pizza. What happened? Where's Omosh? Ameendea chai na pizza. Yani nilimtuma pizza akapita nayo. Pizza tatu. Yeah, now we have pizza, we have nyama choma as well, so you can come through on Samaki and you get to enjoy the good vibes and good food, good music, ambience, and ample parking space. All right, definitely, luku yangu ni safi, and the suit is coming from HLM. They are over here on Shujaa Mall, at Shujaa Mall. That's just opposite AdLife Plaza on the ground floor. They have amazing suits. If you want to look amazing the way I look tonight, you come and pass by HLM. Wambie uko na harusi. Wambie, yo. Usienda hapo kwa Rorashia tumeshonewa nguo sijui koti shoulder moja inakaa hivi. Unajua wale mafundiwa wale wa hapa. Sasa nataka tuamuke tusifu Bwana, lakini ukiamuka hivi wanajua you can take care of their daughter. All right, you have to look the part. So talk to HLM, they'll link you up. All righty, most definitely. So let us begin. So for the first time on Obinna Show Live, we have a clinical officer. Wapi makofi tafadhali ya mgeni. Yeah. Karibu sana, Daktari Doreen. That's okay?
Sana. Yeah.
Doreen Meeme.
Yes.
Hii jina yako ya pili nikaa nimekutana naye online kwa mafani pictures, memes.
But it's a double E.
Mbona ni Meme na double E? Isingekuwa Mime?
People call me Meme, by the way. People call me Meme.
People call you Meme?
Yeah. But it's all welcome.
Iko tu sawa?
Yes.
Doreen Meeme. Yeah. Let's stick with Doreen. Ndio mambo isikue. Okra water, pineapple, yogurt. Shasikia hizo story.
Yes.
Ni ukweli ama ni uongo? Na pot, unajua pot?
Yeah.
Pot. Mrenda. Ile. Umezisikia?
Yes.
Is it true?
I would say a yes or no. It's all about good nutrition. Good nutrition boils to a healthy body, a healthy coochie if they want it healthy. So you need to eat well, hydrate for you to maintain the right pH. Otherwise, even if you just take yogurt every other day and you don't get other nutritious items within your diet, it's like a zero. Yeah, and also lifestyle, hygiene, all those merge into one. Okay. So it's not just I'll take pineapples, then I'll be okay. No.
Kuosha na yogurt?
No, that's a no.
Usioshe na yogurt?
No.
Mala ina sukari.
That thing cleans itself, so there's no need of washing with even water inside. Just maintain the external part that is very well kept, well cleaned. Don't use soaps, especially the medicated ones, because it will also affect the pH.
Piga na antiseptic. Nasugua mpaka inatoa povu.
Sasa hapo ndo makosa utokea, and then they want to run to the yogurts and the pineapples.
Hata ile Arabian shower. Unaipinya hiyo alafu unaiosha kama car wash.
Anaosha nini? Ni uchafu gani iko huko?
Sijui wanasemanga hivyo. Wanasema you know as a lady you have to take care of yourself, you know. So unaona amefinya shower.
That is actually doing injustice to your body. Yes.
Umesikia? Endelea mwaga nini uko ndani. Maswali zinakuja kama hizo. Maswali moto. It's gonna come on his own time. I was just testing the water so you know penye tunachezea. Tuko huko. Karibu sana Obinna Show Live. It's an honor to host you.
Thank you.
We've made this habit of hosting madaktari and the likes, people who know things about health, so professionals.
Yeah.
So at least tusaidiane, because there's a lot of conversations that people frown upon and they don't talk about them, but they're very important in the society, especially for the young people. Wananyamaza hivi lakini kasa unaona mtu akwa amejua that kusugua na gunia ni makosa. But now they're gonna know.
Yeah.
Pamela, toka huko. Naandika notes ya nini? Pamela shanza kuandika notes. Andika okra water.
Nitamtumia PDF copy.
Hata soma. Mwambie tu Pamela no. Karibisha mgeni, upatie mgeni kitu ya kunywa jamani, alafu mambo ichemuke.
Hi, my name is Pamela, the hostess here. Yeah, me I have one question concerning that, though I'm still young to know all those. It's a bosom crime.
See, we will talk about it later.
So nijiulizie tu dakika moja tu. Is it a crime?
It is restricted.
No, is it a crime?
In some context, it is.
But it's some can abort?
Yeah.
Okay, thank you. What can you be offered?
Just see me behind the tent. I'll give you all the details.
Okay. What can I offer you as a drink?
Okay.
Yeah.
Water.
Okay.
Haya. Mela pia amekuja na maswali zake. Naona kuna watu washaogopa hapa. Felista anasema, good night everyone, bye. Mambo inaenda kuchemuka. Yeah. Wacha tuanze sasa maswali sasa. We're here to talk about 3 things. Family planning, and then tuingie hygiene, and then tuingie abortion. Sindio? Tuanze na family planning. Simple terms. What is it?
Family planning is simply a method or a way in which a woman is protected from getting pregnant until when they are ready. So it can either be a device or a minor surgical procedure that is performed. When I talk about devices, it's because they come in different forms. You can have the pills, we can have the condoms, the injections and the implants.
Yeah.
The intrauterine devices are commonly known as the coil. However, there are 2 types of the coil. And then when I talk about mini surgical procedures, it includes the vasectomy and the tubal ligation. Now, when you talk about vasectomy, simply that will be taken part by the men, because it's a surgical procedure done to make them sterile for a permanent period. So it's not reversible. When they get sterile, it means they cannot make a woman pregnant, but they can still enjoy their sexual life without any interference. For women, they get the tubal ligation, which means that their tubes have been tied. So the communication between the uterus and the ovaries has been cut. So even if they happen to have unprotected sex, the sperms cannot be in a position to meet up with the mature egg for any fertilization to take place. So each of these methods have their own advantages and disadvantages. But of course, I'll classify them as either short-term, long-term, or permanent. The short-term methods are the pills, the injections, the condoms, and even the natural methods like counting the safe days or the withdrawal method. That is short term because it has to be used frequently for you to be able to interrupt the conception. For long-term methods are those that go beyond 3 years and even up to 10 or 12 years. And these are devices that are inserted in a person's body. And this is the woman. It's unfortunate that clinical trials about having pills for men to aid in contraception have not borne fruit to date. And so the burden has been left on the woman. So the permanent, the commonest methods that are long-term, that means you can have it for quite a long time, remove it and you're able to conceive, include the implants, the ones that are placed under the arm, the injection, the intrauterine devices, the coil. So the coil can either be hormonal or non-hormonal. So to most women, they prefer the non-hormonal IUD, which they call the coil, not because it is superior to other methods in terms of providing protection towards conception, but because it has fewer side effects such that it doesn't affect your natural hormones. So most people would prefer for that to go for that method, but it doesn't mean that if you get the coil, you will react the same way another woman reacted. So each of these methods favor different people because all women are different, their hormones are different, and even their personal characteristics. So most of the common side effects of hormonal contraceptives, which include the pills, injection, and the implants, are changes in monthly periods. So sometimes you don't get your periods for quite a long time. Like you get into a state of amenorrhea where you don't have your monthly periods, even up to 6 months, 1 year, but that is still okay. It's because the hormone that is being produced is mostly the progesterone, and it thins the endometrium. So the endometrium is what we shed off as periods when we don't get pregnant. So it's totally okay, and it is okay if any woman out there is using such a method and they are not getting their periods. So your periods are not trapped anywhere. If they were there, it would have come out. So this is one of the misconceptions that most women have. If you give them an implant and they stay for 3-6 months without their periods, they come back in panic mode. But also this also goes to the providers who gave it. This is the type of information they should give these women, so that if someone adds weight, or they lose weight, or their mood starts changing, they are aware that it is as a result of the contraceptive. And then again, most of these contraceptives, they are reversible. If you get side effects that don't sit well with you, you can always remove it and switch to the next. You cannot always tell that a method will be perfect for you until you use and experience it. So that is the unfortunate thing about contraceptive. But when you visit a reproductive health expert, they are also able to see how eligible you are to a method. For example, the coil, the non-hormonal one, which most women prefer, there are women who cannot use it because they have very heavy crampy periods. So that is always a disqualifier. We will always advise you to use the hormonal IUD instead, because the hormonal IUD will help in minimizing the periods that you get, and in a way it silences the uterus. So the cramps that you get during your periods are usually minimal. So it's a benefit and as well as a contraceptive. For women who have very normal periods, less cramping, they are eligible for any of the methods, because either way it will not affect. The reason as to why that copper T is contraindicated, or a person who has heavy periods and crampy periods can't use, is because if you have it inserted, that is one of its side effects within the first 3 to 6 months of use. So if you're already having heavy periods and cramps, this one is going to exaggerate. And this is the most common reason as to why IUDs get dislocated. Someone says that they got an IUD, it's dislocated, they got pregnant with it. That is one of the reasons. And this should have been picked by the provider at the time of counseling, when you have a one-on-one with the client who wants the contraceptive. So it is very crucial to visit a trained provider. Maristops facilities are all over the country. And we offer expert advice and screening at the point of contact. So we are able to get the most appropriate method. It might not be the best, but most chances it will end up as a good contraceptive option for you. So it is always necessary for that. So when we talk about permanent methods, these are for people who have already had the number of kids that they want. Kama nikutumie kama example.
Who told you I've already had the kids I want?
Nakuuliza wewe umetosheka?
Hapana, I want more children.
Unataka wangapi?
Nategemea. Sina number lakini I love children. So if I get a beautiful lady.
So vasectomy is not an option
the
for
reversible one, the temporary one. I love to. So for now, I can do. In fact, we're talking about vasectomy with Melvin Alusa today. And I told him we'll get a professional tell us about vasectomy, because I'm thinking about it. Because kuna some shorties here are planning to trap me with children. So unakata tu lakini umwambii.
So it only works if you tell your partner. If you don't tell your partner, you
it
still
doesn't work. You still get pregnant.
Yeah.
Yeah, so I'll not tell them so that they can still get pregnant. But I'm actually thinking about it.
So vasectomy is a permanent method that is offered to men. It's a minor surgery. It's 5 to, let's say, 15 to 20 minutes, you're done. You don't need anesthesia. It's just a local anesthesia at the point where the surgeon is creating a small incision, locates the tubes, and then cuts them. So for vasectomy, most men are skeptical about it because they equate it to castration.
Exactly, man. Damn.
Ni uongo. So that's a myth, and I want to bust it. We've had so many men come in voluntarily. They want to help and ease the burden of family planning from their women, which is, I find it very admirable. It means they have already taken that responsibility, because this woman has carried the pregnancies to term for 9 months, maybe 3 times. Maybe they went.
We devolve.
You devolve.
Not one woman. Not one woman, 3 children, 3 women.
Kila mtu moja moja. So there are women who have given birth even up to 6-7 times, simply because they even didn't know about contraception, or they just refused, or it's just their choice to have as many children. But the more children that you give birth to, the lesser the quality of life you can lead as a woman. That is proven. Even the life expectancy reduces, because anytime you carry a pregnancy, your immunity goes down. Even other parameters. That is why we do antenatal care, to make sure the mother is in a good state throughout the pregnancy to take care of that growing baby and bring them to term. You've heard of women carrying babies frequently and losing the babies simply because maybe their bodies were not in the right state of accepting that. So we also offer such services. So what I was talking about, men, it is a good thing. Just know that when you get that vasectomy within 3 months and it's confirmed. So actually after getting a vasectomy, you have to use an alternative method like a condom or abstinence, or your woman to use maybe another method like a pill or an injection. Up to 3 months, we do the semen analysis to be sure you are producing 0 sperms. So it's like, sasa hii si minute maid, ni hii yenye unakunywa hapo, inaitwa aje?
Steam.
Yes. So it's just juice without seeds. So you still ejaculate, but there are no seeds inside.
Bado na nini?
Yes, vizuri sana.
Hey.
Kabisa.
Si watu wanasema hiki nini? Hey.
No.
Hey.
So that's a myth. Please consider that option when that time comes and visit us.
Na nini yangu?
No. Wamekutuma. Wenye wanataka kukutrap.
Wamekutuma.
Hawajamtuma.
Mimi trap. Mimi nitalea mtoto lakini kukua hapo ndo sitakuwa. Sema it's fine. Let's raise the baby. So wacha niulize hapa kwa vasectomy. Wanakata wapi?
You see you've had the anatomy of the male genitalia. There's that tube that transports sperms from where they are produced. Yeah, from where they are produced. And then there's this other one that brings in the semen so that they can mix. So it will be cut at the point before you reach the connection where the semen comes out. So semen itakuja na hii side ya kutoa sperms hakuna.
No, you don't understand. Like nauliza wapi? Is it in the balls or in the thighs? Like
so hapo kwa scrotum kuna ka joint hapo.
When you're sensitive.
But you will have a local anesthesia.
Watadunga hapo shindano.
Si mwanaume asikiangi uchungu hata.
Wewe ni mwanaume? Umeidungwa? Very good. Stay out of this.
It's not very painful. Of course, you will feel a sharp pain, but once the area is numb, ni hivyo.
Inachukua how long kupona?
Within 2 weeks. Of course, there are those activities that you will be restricted from doing, like driving for long hours, cycling, so that you allow time for the insertion, the place where they did the incision to heal. And also avoid maybe having an infection. So you'll also get tips on how to take care of that site. It's a small incision, not a big one.
Okay.
Yeah.
Hii nimejua wanaume wengi hapo wanataka kuuliza, si mimi tu. Mtu bado unasikia utamu.
Kabisa. Kwanza inaongezeka. Because no worries. Because unajua mimi nitascore tu na niko sawa. Si ndio siku.
Kore twende. Mbona Sharon anariact nikikwambia twende? Sharon, kwani unapangia Korir?
Si ni ukweli, if unajua kila kitu is under control, that thing gets even sweeter.
Twende. Kwani Chak unataka watoto ngapi? Si moja. You want 7?
Father Abraham.
Okay, sasa wadau, mimi nataka ni announce hapa kwa kipindi ya kwamba siendi. No, but I'm actually really like niko 60% sold. I'm like, my G, you gotta pull up. It's fine. Family planning for men. Gotta trim it, man. Gotta cut it off. So hizo nini zitaenda wapi? Si zina growing kwa mwili?
Hapana. Those are just microscopic things that are also like they will be reabsorbed back into the system.
Balls hazitafura?
No.
Anasemanga nini zinafura juu saa kuna mali zinaenda.
It's the same way when a woman ovulates and they don't get pregnant. Where does that egg go?
Kama hii sio kama nini?
It will come out, right? As?
Si periods.
No. So you're very wrong. Periods is just the endometrium.
Mayai. Okay.
Fallopian tube.
Uterus.
Yes.
Sperm. Ha. Baby.
No.
Nakuambia yangu. Alafu niambia daktari. So far so good, si ndio? Haya. Egg. Pap. Fertilize here. Problem. Okay? But the good place to fertilize is here. Ovary. Sperm, poop, baby. When no sperm, periods. Wall. You get me? So many understand?
Nimekuelewa kabisa.
Sio hivyo?
Sio hivyo kabisa. Yes.
Hutu mayai tunaendanga wapi?
So hii mayai inafaa kuwa fertilized at the fallopian tube. Actually umenipea idea. There is no need of drawing the womb.
Si ndio hii?
Unakaa womb kabisa.
Leo nimekuona sana but it's
diagram already.
Diagram ndio hii.
So my diagram, please
be
steady.
Okay.
So there are 3 phases of the menstrual cycle. So the first phase is immediately after your periods, you get into the first phase yenye inaitwa follicular phase, where the egg that the egg is supposed to mature until it bursts out to release, so that it can travel along the fallopian tube. At that point, the sperm should have climbed into the fallopian tube to be able to fertilize. So that is where fertilization takes place. Actually, beyond the fallopian tube, hiyo mayai ina take like 2 days to travel. So you can only get pregnant 2 days of your cycle. So if it has traveled the second day, that day hata imeanza kukuja na huku, haizijamit, hata zikimit hapa, haiwezi kuwa fertilized, already kasha lose that viable ability ya allow the sperm to penetrate. So fertilization ikitake place hapo sasa wanaanza kutravel kutafuta mahali ya kuimplant. So in the womb, it's where they implant to continue growing.
Na hii wanasemanga nini kikuwa hapa inakuanga inaitwa ectopic pregnancy. Is it ectopic pregnancy?
Yes.
Hapa.
Yes. You're very correct. So once fertilization has taken place, the egg is supposed to travel ideally, and there are like hairs within the fallopian tubes that propels it to the uterus. Okay. So if that doesn't happen, simply because maybe the hairs are weak or you had a very chronic infection that affected the fallopian tubes, kanakwama wapi, hapo ndo kanaendelea kugrow. So that is a very high risk pregnancy, and it has to be terminated, because otherwise, haiwezi grow beyond 8 weeks. It will rupture and you bleed internally. Yes, so unfortunately, once that is done surgically, and you might lose the entire, sasa kama ni left ilikuwa lose your fallopian tube. So even your chances of getting pregnant now have reduced. Because every month, maybe you will ovulate with this side, then his side. Ukiovulate both sides, maybe utapata twins. You understand? So it's also risky. And when we talk about hygiene and misuse of contraceptives, especially the P2, the P2 continuous usage of P2, tunasemanga P2, use it twice a year with an interval of 6 months. Yeah? But siku hizi watu wanameza kama
Ebu rudia.
P2, the emergency contraception, you should use it at most 2 times a year with an interval of 6 months. But siku hizi kila Friday
Walikuwa nauliza hapa. In fact ulianza wakata na story ya P2. Mpaka nikaandika wakasema hapa P2 safety cramps alafu same day. Kuna mmoja anasema amelimwa leo na akameza P2 leo. Is it safe?
I would say P2 ni 50-50 because the essence of having a P2 is if you are in that phase ya kurelease mayai, it delay release of that egg. If you had already released the egg, hata umeze P2 10, nothing. You will still get pregnant. And the risk is that, you know, that P2 has a very high level of the hormone. It makes the uterus very harsh for implantation. So the kamayai that has been fertilized might decide kukaa huko kwa fallopian tube ikue ectopic pregnancy.
Uterus ni hostile.
Yes.
Kuna mtu hapa alisema alimeza P2 na baada akashika mimba sasa mtoto wake ako P2.
So she had already ovulated. So that's why P2 haikumsaidia.
So mnasema nimemeza P2 kumbe usha ovulate.
If you are ovulating, and there are women who can tell when they are ovulating. There's that ovulation pain that you feel either on the left or the right side. And also the stretchy mucus. You can be able to tell, I'm ovulating today.
Ovulating inakuwa pain na kwangi raha. Sinafikiria inakuwa ni raha.
There's a bit of discomfort to some women that is prominent. Others it is silent. They only get good moods.
Ndio nimekwambia
na wana glow.
Anza kutext asubuhi, good morning handsome. Mkola, are you breathing today?
Hiyo siku haitishi fare, anakuja tu.
Mpaka anakutumia fare na anakuja.
Exactly.
P2 twice a year. Mbona si thrice?
Because of the effects that it produces, that high levels of the hormone are able to persist even up to 6 months, and that is why most people who use P2 end up having irregular periods. Sometimes they bleed in between periods because hizo hormones bado hazija clear kwa system.
Haya, mambo ni live, mambo ishaanza. Sasa tuanze sasa, tumemaliza sasa na tumesema si tutaenda kuangalia story ya nini baadaye, hiyo ya Bamorio.
Ni kama si sasa ni leo tu. Book through your namba yetu. Ni 200 tu kubook appointment.
Pia nyinyi mnakata watu nini?
Sisi ndio wakataji.
Marriage stops?
Yes. We even do camps. Actually, in 2022 November, we did a camp at Samia Business Park. We have a branch and at Sili Nursing Home, and 250 men turned up.
Wakakatwa?
Yes.
Ni pesa ngapi kukata?
That was a free service.
But normally ndo ngapi?
35,000. Ni pesa kidogo. Imagine mtoto ni sahani ngapi.
Mtoto atakuja na sahani yake. Yes. 35,000.
Wewe mtoto atakuwa anakuitisha pizza.
Pizza si unakata tu kununua. Sasa pizza, naambia uliza mamako. Hey, mnafanya free camp ingine when?
Uko na
mobilize watu.
Unaweza to mobilize as a free. We still have outreach outlets, but they do it in time. See, like wako Nairobi throughout, but they give dates. You can watch out in our Facebook page. Usually post free vasectomy and tubal ligation.
But these are free, zinafanya vizuri kweli.
Yes, offered by experts. We are reproductive health experts.
Vitu za free unakuwa hapo, daktari ameniambia, daktari umenyamaza, tunakusaidia. Hii kitu ni bure na una nini hapa?
Maristops is an international organization with international standards. So, don't worry about the safety of the procedure, the quality of work, it's catered for.
Sawa.
Yeah.
We shall have a meeting with the baby mamas. Is there anybody who wants to add any before I decide to chop this thing?
Yeah, it's good to have such conversations before we end.
With who?
Your partner.
Which one?
Maybe they want more babies. They want more babies.
Nijikute. Nini aya. Turudi hapa sasa kwa family planning methods za mashauri. Maswali ni moto moto. Number 1. Dem anaweza kuwa ameweka handbrake. Na baada shike ball.
Yes.
Because of why?
So there are many reasons
Okay.
as to why you can get pregnant still with the implant. Number 1, you can have the implant and you're told to wait for 7 days for it to be active. Unawekwa leo mbio mbio umeenda mechi. Kanaingia. So there is a wait time, 7 days. So they should always wait for that hormone to take effect. That way now they can have unprotected sex.
Okay.
However, you can still wait the 7 days period and down the line you end up getting pregnant. So there are conditions and medications that have reduced the efficacy of the implants. For example, if you are on antiretroviral drugs, anti-TB drugs, anti-epileptic drugs, you will definitely conceive with the implants. So when we are giving them, we'll take the medical history and they have to be honest.
Okay.
So they tell us so that we can rule out that method for them.
Okay.
Yeah.
Wanaume wana complainingi inawadunga. Especially if you are Luo. Yeah, for the men who are blessed, dem ameenda ameweka machuma huko ndani. Morio akiingia anasikia anadungwa na machuma. Hata mudi na nini. Ni ukweli ama ni uongo?
That is true, but it's dependent on the skill of insertion. So most of the time, that IUD, whether it's the hormonal or the copper one, it has a string to aid in adjustment and placement as well as suspension within the uterus. So after insertion, the strings are left hanging at the vaginal walls. So you need to trim them and tuck them in. That way they will not feel. You trim them at the cervix. Cervix ni yako ka opening ka uterus. So ikibaki hapo ndani, wezi ingia ndani ya cervix. Okay, utafika kwa cervix but you will not feel anything. However, if the strings are left hanging, maybe more than 2 centimeters from the cervix opening, of course you will feel it. You will feel some discomfort. Sio chuma inakudunga, but the string itself. So that way, we usually, when we insert, we usually tell the women, if your partner says they are feeling it, just come back, we retrim the strings.
Is it dangerous?
No.
Haizi umiza Morio?
No. Actually, that string, because the cervix is usually secretory, nakanga tu secrete some discharges. It soaks up in the discharge na inakaa kama a part of the body.
Okay.
Yeah.
So umesema mtu hawezi pita cervix.
Huwezi.
Basi mbona wanatudanganyanga wanatusikia kwa tumbo?
Maybe
ama kwa throat. Tigai. Uko tu huku.
Ni ku-exaggerate. Labda
anakumotivate. Aki umenikoka kidney.
Anakumotivate.
Oyo ni motivation. Sai kwani ni ukweli? Chaku jaambiwa? Si hiyo.
Hiyo ni motivation.
Kwa nini jaambiwa? Ati gai. Haki we na kusikia kwa shingo gai. Kumbe hata kupita tu cervix atupiti.
If a woman is pregnant, you can still have sex with them, right? But unaguzanga mtoto? Hapana. And that coil iko hapo penye mtoto anakuanga. Yes.
Guy, you've shifted my ovary. Unata strings za cervix ndo sijafika. Sasa hii mtu ajaribu kunidanganya. Unaniambia kusikia throat na kuacha tu hapo saa hiyo. Kapo na hiyo throat yako. Na niulize. Haka ako kachuma. Kana stopishanga mtu aje kukua pregnant. What's the science behind it?
So Utoto wa kuweka huko ndani ni type 2. Kuna the non-hormonal one yenye iko na copper, yenye watu wanaita coil sana sana. So the copper itself is a spermicide. Ikiwekwa kwa uterus, it releases copper ions. So that copper ion ni kama askari analinda. So ana shoot.
Munaua watoto wangu.
Hao si watoto, ni majambazi wanataka kuhijack.
You just call my kids wajambazi just because they got a tail and not legs. Okay, so those copper ions ndio zina guard. Oh, okay. And then the other one, hormonal?
The hormonal one, it produces an hormone called progesterone which suppresses ovulation. Sasa mwanamke ndo hatoi mayai. Hai affect the sperm, it just stops the eggs from releasing. Yeah.
Is that safe? Is it good for the woman?
It is. Because once we remove it, you're able to get back to your normal ovulation processes. It's just that imeweka pause.
Okay.
Yeah.
Hiyo ndio inafanyanga watu wana bleed sana. Nakwambia, hoi, guy.
No. Copper T is the one that has hiyo non-hormonal, hiyo ya copper.
Ya masoja.
But in the first 3 to 6 months, na si sana, if you bleed excessively, then that method is not for you. Of course, there are remedies when you come back. There is a combination of drug you're given to help your body accept the IUD. But if it doesn't, then you have to remove it and opt for another method.
Okay. Which one is the most common that watu wengi sana wapenda kutumia family planning method?
Copper T, the non-hormonal one.
Yeah.
But let's say out of 100 women who use it, 10% will not continue using it because of the side effects, simply because that was not their method to begin with. Yeah. But 90% will cope very well with the copper T. The other methods are 50-50 simply because of the hormones. Wengine wananona, acne, mood changes.
Yeah.
Yeah.
Haya. Hebu mlete hizo maswali zenyu, nimeona mukinini hapa, mukileta juu ya hiyo Felix anaitwa Felix Vunda. Anasema kuna wenye wako na lower uterus, dogi wanafeel uchungu. Is it true? Like huwezi jaribu stingo deadly. Kuna positions zingine ukiweka mtu wako anasikia mauchungu. Is it true ama wanadanganyanga?
I would say pain during sexual intercourse is abnormal. It doesn't matter how low your uterus is or how high your uterus is. If you feel pain while having sex, you need to get an expert screening. Maybe you get a cervical cancer screening, maybe a pap smear to see if your cervix is healthy, or even an ultrasound to rule out infections within the uterus, like pelvic inflammations, endometritis. Those are some of the common causes of pain during sex. And most people may have bleeding in addition to the pain. So if their partner is feeling that it's not about the location of the uterus, please let them go and get a checkup.
Okay.
Yeah.
Doreen Lampa anauliza, ask her if FP or family planning ufanya dem kwa baridi huko chini. She just freezing, man.
It's not about freezing. I would say most hormonal methods like the implants and the injection, the ones that contain progesterone, they usually make the cervical mucus very thick. So maybe the thickness is what reduces maybe the pleasure, because it is very thick. You know, it has to be slippery. So si baridi. But I will not dispute the fact that progesterone sometimes excessive levels of progesterone in the body lowers your libido. When this, we are giving you contraception so that you can enjoy sex, right? So if it makes you not enjoy it, then you would rather have it removed, or come for supplements that boost vigor. Supplements ni minerals, vitamins, juu huwezi kula matunda zenye zinaweza kupea all the minerals zenye unaweza taka. But we have supplements that help boost that as you have your contraceptive on.
Okay.
Yeah.
We need to have the 18 plus logo on the screen. Haya, kuna mtu hapa anauliza, no, sasa nimepotea. Alisema Lucy Kemunto, mbona mademu akitumia hizo coil wananuka vibaya sana?
So I would say when you get the intrauterine devices, I talked about the string that hangs at the cervix. And the cervix is a secretory organ. Ndio inatoanga hizo mucus. It's part of it, apart from even the vaginal walls and everything. It majorly secretes that.
Okay.
So when you have that string there is continuous stimulation. So you will discharge a lot, especially during the first year. This is where now hygiene part comes in. So you need to keep yourself well, so that you don't have those discharges. Some people use their panties anahang kwa bafu, after one day bado ndio atavaa the other day. So we encourage people to hang their panties outside. At least zipate sunlight and fresh air, and then when you fold it back, don't wear it immediately. Like ukuwe na mingi za kama za wiki moja jamini. Then within 3 to 4 months, keep on changing them.
Okay.
Yeah.
What causes torsion? What's torsion? That's Nasrallah.
So testicular torsion or
this testicular
fallopian torsion. Torsion ni kaa twisting. So for testicular torsion, maybe ni a bad fall or a trauma. Mostly occurs in young boys, up to 12 years, the playful ones. Maybe uko kwa field alikuwa anacheza football nini, then it happened. It's a medical emergency na anafaa akimbishwe mbio kabisa. Otherwise ataua future generation before time ifike.
Mbona mtu akimeza pills ufeel kutapika na kizunguzungu? Judy Njoki.
Pills. Most pills have both hormones, estrogen na progesterone. Remember, you also have your estrogen and progesterone levels. This is an oral drug yenye unameza kama vile unamezanga Panadol ama Flagyl, Amoxil. Ina go through digestion, right?
Okay.
The process of digestion can emit such responses. Unaweza feel kutapika, some may diarrhea. Kutapika and diarrhea also reduces the efficacy of the pill. Unaweza fikiria ulimeza but ulidiarrhea. In between unapata ball. That is why we say pills is among the least effective methods. Okay. Yeah.
Why do our ladies complain about mgongo na kiuno pain time ya periods?
So when you're having your periods, the uterus is producing some chemicals that causes contraction. Ndio hiyo endometrium ing'oke. Wacha niseme tu in layman's language, ianze kung'oka from where it is. So that process, obviously, to some people, it's quite painful, but excessive pain is not normal. So painful menstruation is abnormal. So there is always that aspect of enda tu kwa daktari. You've heard of endometritis, which is very common nowadays. Because people used to tell, ni period pain hiyo ni sawa. No, it's not normal. Period pain should be manageable. Actually, you don't need pain medications to manage your period pain. Yeah.
Okay. Fei anauliza kuzaa huwa inapunguza period pains?
I would say that's a myth.
Okay.
Because I've had experience with women who have given birth 2-3 times, but they still have the painful periods.
Okay.
Yeah. So it's not 100% when you give birth, your period pain will go away.
Okay. Haya, tumemaliza hiyo ya family planning methods. For the ones asking other questions, hapa tulikuwa tumeshazi cover. Just go back to the beginning of the conversation, you'll get to see that. And now I want us to move into another thing. We want to move into hygiene. Tunataka kusonga into usafi. Kunywa kamaji kako tafadhali. Wacha niongee na watu wangu kuhusu wadhamini wetu. The show has been powered by Mozart Bet. Of course, I want you to jump onto the platform, download them on App Store and Play Store as well, so you can get to place your bets and also get the greatest gaming odds. And also, while you're over there in the casino, you can get to play a couple of many other games. Check out this video.
I need some cash, I need some money. Sleep imejaa na magame kachwane. Mshipi kinasa mina osa. Niko Mozart, walai sisi toka Mozart. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet. Mfuwa ni ya free bets inanyesha. Utapata nimeconcentrate na aviator. Casino niko ndani, bora niongeze pesa. Multi-bet kaza na mshipia leather. This one, that one, slipi lete lamsa. Kericho, Kanairo, Nakuru, Mombasa. Mozart bet ni washindi tumejaza. Umeshinda jackpot, mimi nipewa cashback. Free spins hapo kwa casino. Virtual games pia ziko. Nasema free spins hapo kwa casino. Welcome bonus pia iko. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet. Ukilose game moja jokwa multi bet kuna refund. Sasa basi no regrets. Best rapper in the game na bet with the best. Kasi Mozart, no sizi bet na the rest. Futa bake tennis na ruji. Odds nizijaze, mechi zimerudi. Game inaendelea, nisha stake 2G's. Utamua live bet ni kuwatch game ka movie. Stake, mina stake nikicheki ganji, ikijaminate mina ngoja pay, utalafu ndo ni set. Rada Johnny Mozart, nisha validate. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet. Angukia welcome bonus Mozart bet. Biggest odds in the world Mozart bet. Casino, jackpot Mozart bet. Mozart bet, yeah Mozart bet.
All right, there you have it. So jump onto Mozart Bet. While you're over there, you can get to try your hands on a couple of many other games on the platform. Changamuka nayo, anguka nayo. So having a conversation with a clinical officer. We're having tuko na daktari hapa tunaongea mambo family planning, the side effects, and right now we are switching into hygiene, then tunakuja kumaliza na abortion. Usafi tuliguzia mwanzo tukianza. Kuna theories watu wengi wanakuanga nazo, hizo matheory za yogurt, pineapple, da. Tuambie tu sasa, so that we don't also last in this conversation for too long. Usafi tunafanyaje?
So in simple terms,
Okay.
the vagina is self-cleansing.
Okay.
So you don't need to insert water or yogurt or garlic to get rid of whatever that you feel it is there. So if you have an abnormal vaginal discharge, which can be carried in nature, like imeshikana kama yogurt, inaweza kuwa yellowish, greenish, those are abnormal discharges, and it is an infection that needs medical treatment and not washing with yogurt or eating pineapples. So hygiene plays a big role when it comes to maintaining the health of the female organs, the female genitalia. So even how you go to the toilet and wipe, we say you wipe front to back. Others wipe back to front. And the bacteria that is at the back, when it comes, it is normal when it's at the back. But when it comes to the front, it distracts the normal healthy bacteria that was there, maintaining the pH and the health of it. So ndo unaanza kupata yeast infections, vaginitis, yeah. So you need to watch out on that. And then even the products that we use. I've seen people complain of some brands of sanitary towels, the soaps that people use. So if you notice a brand is not doing well with you, sometimes you may have blisters or peeling of the skin, just change it. And also people should normalize even staying free of panties sometimes. Yes. Si panty 24 hours. Ukifika kwa nyumba, sijasema mtembee kwa street.
Nataka kuangusha kampuni ya
Hapana,
Mango Desto,
bado
ndio?
tunazihitaji tena
Umeangusha kampuni ya
sana.
Kamisi, kampuni ya Bram umeangusha. Sasa mnaangusha kampuni ya kifuniko ya asali.
Hapana, hiyo kampuni haiwezi anguka.
Hata ya Baika mliangusha. So umesema tu kwa keja free.
Yeah, when you get back from work, just take a shower, uvae tu dera ukue tu free. Ulale hata hivyo. It's
Okay, keep going.
So there is someone who will get out of their house. I'm sorry to say, not every woman is clean, but it should be a habit. That is why you are a woman, right? So ukitoka kwa nyumba asubuhi, when you get back from work, just take a shower. Usiseme nimekuwa kwa ofisi, I've just been sitting all day, sina uchafu.
Naoga kesho asubuhi nikirudi job. Wengine wanapiga hata nini?
Passport.
Wacha passport, aogi 2-3 days. Anasema gai, no, mimi sinukangi jasho. In fact, mimi nimeandika tu kwa computer.
So when I say it is self-cleaning, why is it cleaning itself? It means the discharge that is coming out is getting rid of some things that should not be there. So I do stay like that for 24 hours. Enda uoge at least tusaidie pia wewe ku eliminate the excess. Of course, when you discharge those things, okay, itakaa vibaya, but
Sema vile iko.
when you discharge and you don't bathe, even your labia zinakuwa na uchafu. So hata it's a turn off. Huwezi katia dem kama huyo mara mbili. Hata kama mnasemanga mtaosha, akwe.
Nani anasemanga
Kuna
ataosha?
tabia amwezi osha.
Hard wash siku hizi.
Mnachukua mwenye amejiosha.
Wewe utakaa na harufu korir? Very good. Si ni ukweli? Watu wa kwetu wasafi.
Lakini mwanaume ni kajasho? Ama ni pesa?
No. Kuna wanaume wenye ni kajasho. Mimi hata jasho yenyewe siipendi on myself. Sasa imagine unanuka, hata unalalaje hata kama mkimorio. Unafika nyumbani unaoga unavaa jammies.
Yes, that's it.
Cotton unalala na mwili. Hata unafikiria level unajispray cologne before ulale na uko peke yako. Nalala. The only thing you don't apply when you're going to bed is deo, because sasa also unataka sasa nisa itoke vizuri.
Yeah. That's it.
Brush your teeth before you go to bed.
Exactly.
Nasikia chaka ananiangalia zilizo. Okay, haya ndio mmesikia hapo. This is a Contraceptive Memo. This is a warning to wale wa sim 2 and 1 infections kibao. Ndio hiyo. Yep, it's getting there. Aya, leteni hizo maswali zenyu. Aya, wanauliza okra water.
So, as I said, okra water, the pineapples, these are alkaline fruits that help in boosting the vaginal pH.
Okay.
So, ni zinasaidia tu, but it's not the only way.
Okay.
Yes.
Is waxing recommendable, Pauline Wambo?
Yes, but you have to make sure you are getting it from a professional. Look for spas that are of high quality, that
reputable.
have been yes, so that usiende kuchoma huko na wax. Some wax are of low quality, and they may do more bad than even helping you clean out the area. Yeah. And then also the products that they use. Napatanga kuna those basic products that they use after waxing to ensure that hiyo muwasho haiko. Most of them are harsh to the environment around there. So you might encounter an episode of waxing, the following day you are at a gynae's office with a itching vagina. Yeah, simply because they use the wrong products that are not good for the area.
What is the purpose of the hair around that part? Because si Mungu aliweka hapo.
Aliweka hapo lakini surely tunasemanga inasaidia kutrap dust, but sasa ikitrap dust hapo alafu
Kazi yake ni kutrap dust. Dust inaingiaje huko?
Okay, not like trapping dust, trapping dirt like hiyo kuna wenye wanasema hiyo discharge isiende kwa panty or what, but coming to think of it, are you going to maintain that area as clean as possible? You can have it there without shaving, but you're totally clean. That is okay, because we have religions that don't shave, or when they shave there's a specific part that they don't touch. That is okay, but are you able to clean it well?
Okay. Unaitumia kama water catchment area. Haya, Zulfa Campbell, yoni steaming. By the kuna hii steaming, hata Zulfa Campbell ameulizia story. Mwenyewe steaming, kuna tu vitu tudem tunabai hivi, anaambiwa akifika kwa nyumba, anawekelea, anakalia ni kama toilet. Anamchapa na kajoto alafu chemicals.
I know they have been widely used and recommended even by some medics. I wouldn't dispute the fact that they have some additional value to maintaining the pH of the vagina. Most of them are boric acid suppositories wanaweka huko ndani. Hiyo yoni steam also produce that acidic moist. If it gets in there, it is able to balance out the vaginal pH.
Okay.
Yeah.
So it's not bad.
It is not bad, but you have to get a recommendation, because kuna mwenye atapata make things worse. Yeah.
Reggie Flavor anauliza, ni ukweli probiotic yogurt hufanya mambo inakuwa tight huko chini?
That is not proven yet.
Okay.
But do you know how expensive probiotics are? I don't want to dispute the fact that hizo kampuni zinasema probiotics ziko huko, but I don't think they put enough kwa yogurt ya 100. Imagine buying a probiotic yenye ukienda kwa maidawa ni 3,000 kwa yogurt ya 100. Sisi wote tutakunywanga yogurt. So I don't think it has enough. Yes. So probiotics, get them from verified suppliers. Need to tabs ama some solution, some solvents that you put in a solution and you drink in water.
Okay.
Yeah.
Frida Mutuma, baidha ni nini uchoma panty inakuwa ya white katikati?
The vaginal discharge. So I've said there are those I would say the wrong discharges. So the right discharge should be whitish and unsmelly, or stretchy, clear.
Okay.
If it is yellowish, greenish, thick like a yogurt, you understand? All that is abnormal, and it's an infection, but it's not a bacterial or fungal. There are so many infections of the vagina, from viral to fungal to bacterial. So you need to go and get that discharge evaluated so that you get the right treatment.
Okay.
Yeah.
Happy Clarie, after menstrual periods, there is a mucus fluid that comes out with a bad smell. Is that an infection?
No, that's not an infection. I would say it's the final layer of the endometrium that is coming out. It is usually brownish in color, but it shouldn't persist beyond 1 or 2 days. Ikienda beyond that, you need to be examined for a possibility of a vaginitis. Vaginitis is an infection of the vagina, which is usually bacterial.
Okay.
Yeah.
Kenyan Sabotua. By the way, does Titan gel work? What Titan gel?
I've never heard of that.
Gel. Chako umejua? Titan gel. Kuongeza manhood. Sasa hiyo inaingia tu kwa hygiene. Aki watu wanapotezanga direction kidogo. But hiyo kitu pia haikuangi ukweli. Wache kunini. Bwana nini? Which soup should they use to avoid rashes on the upper part? Masi Njoroge.
Which?
Soup.
Soup.
Kuna
Soap.
wameandika soup. So sijui kama ni soap ama ni soup.
Rashes on the upper part. Which upper
Anamaanisha
part?
soap lakini ameandika soup.
Or maybe after shaving. So shaving, if you are not doing waxing, yenye inatoa mpaka roots, when you shave, don't shave clean. Because you will create a room where the hair that is supposed to regrow may curve in and cause a pimple. We call it an ingrown. You understand?
Okay.
So it's the shaving technique that causes that.
Okay.
Yeah.
Colleen, my second day of periods huwa inanuka vibaya. Any solution?
So kunuka vibaya is what I don't know, but any content of blood has some elements of iron. Na iron as a metal iko na its distinct smell. So I don't think, sijui kama amecompare na ya mwingine akasikia yake ndio inanuka vibaya. But anyway, they can always get an advice. But if it's on the second day of the period, unless they are having an infection, then that's normal. There's a smell yenye inakuanga kwa periods. And that's why we advise people, don't stay with the pad for more than 2 hours. Yeah.
Nuka kama mabati. Mabati iko na rust. Like, babe, do we have visitors? Nakwambia guy hata sijui unauyis. I can smell them. We have intruders.
Unafaa unijoin kwa hii profession unanisaidia kwa aspects zingine, naona uko na experience mzuri.
You know why? 3 baby mamas. Number 1. Number 2, I have 3 daughters.
True.
My first daughter started experiencing a period. I think in a month. I think ama ya 4 ama ya 5 ama ya 6, somewhere there. And I had to really take other lessons about it because I'm the only person niko naye all the time. So I'm like, Dad. So Dad, buy me the long ones. I'm like, huh? No. So naingia kwa chemistry rosafi roju. Yaje. Unapata watu wamejipanga mwana kuangalia nisaidie pads. Watu kuzile Obinna. Yeah, but I also had to do that and also let my son know it's not a bad thing.
True.
Yeah, it's not something to be ashamed of. So normally when she's she's on her days, everybody in the house is very kind to her because I try to make it that way. Like, hey, let's make it easier for her and everything. Let's not make her feel like she's... Yeah, so I know a lot about menstrual health for ladies. Because mimi ndo niko hapo, mimi ndo baba na mimi ndo mama most of the time. So I have to. Yeah, nisipokuwa hapo tena mambo itachemuka. That is why. Ya si ati So acha nikuni angalia na hizo macho muni angalia nazo. Obinna mambo yako Joy. Aya, kuna swali hapa. Mariana anasema kupaka mafuta.
Kupaka mafuta.
Si lotion, si you know, kwani tunaongea juu ya uso.
Aje sasa.
Si ukisha shower ni nini unakaa?
But hapaki ndani.
Si ndani si.
There's just the skin. Where there is skin, you can apply.
Lotion.
Yes,
Ama
but not in between labias. Why are you applying it?
Nataka ikuwe smooth.
Smooth. Na atatembea the whole day. Hiyo ndio hata itatrap in more hizo mauchafu.
Kuweka powder?
No.
Baby powder.
Baby powder ni ya watoto wanavaa napkins.
Si ni baby. Swiss
Sure.
baby powder. Huyu inafaa aende aone daktari. Blenda Mukami, Obinna niulizie hii haki. Kama mtu anapata boils huko chini na ni uchungu, nini inaweza kuwa shida? Enda hospitali.
Yes, please.
Run very fast. Uko na boils huko chini na ni uchungu. Au kuwatch ile episode tulifanya STI ilikuwa last week. Is it last week? Hata haijakaa sana. Last week ndo nilikuwa na professional tukiongea STI tukaonyesha ma videos manini. Watch that video for last week. Sexually transmitted infections. Ama sometimes ni UTIs, but hiyo ya boils kidogo, tafadhali kimbia hospitali. Hiyo hata daktari wacha uende hospitali.
Kabisa.
Yeah, wanataka kugoogle symptoms amekuwa na nini kwa nyumba. Go to the hospital.
Juu anaweza kufa kabla.
Yes, trust me, you will need it. Just go to the hospital, usifeel at yo. Okay. Aya. Katrina kuna swali?
Can you explain the use of boric acid, like when to use, or if it's okay for someone to use it frequently, or when it's
Boric
better
acid.
to use it?
Hiyo ndo gani?
Hiyo yenye ulikuwa unauliza about
Yeah,
yoni
steam.
steam. So if you're healthy or your pH is normal, there is no need of you using them. And that is why I was saying, even before you run into using them, you know, people are in marketing and they are looking for money. They will not tell you that if you're okay, you don't need to use it. But if your vaginal pH is compromised or you have very frequent infections of the vagina, then it is recommended to have such steams to help in reviving the normal pH of the vaginas. So if you're okay, then there's no need of using it. And that is where people go wrong. They end up misusing and then affecting an entirely normal system. Yeah.
So mnatumia boric acid na mjimwagia acid. That's interesting. Si boric acid inatumiwa kwa nini? Kwa pimples?
For acne, no.
Not acne, kuna inaitwa micro needling ama micro what? Walai they use that thing. By the way, wanasemanga ati nini ni nzuri for pimples. Ni kweli? Nini?
So it's not like it's good. It is proven.
Is that the secret of your smooth face? I just had to put that out there.
Ni jeans.
Oh, okay. We can see the jeans. Hata umeivaa, umeidunga.
So,
Yeah.
I would say the sexual act in itself releases feel-good hormones. So mtu tu ako na furaha na mafinyo, like wana glow tu.
So what are you trying to say about Korea?
Atafute mtu asikue dry spell sana.
Yeah, watu hapa naona watu wa glow hapa. Omosh, what's up? Mbona why are you guys not glowing? Pato, Rada? Zikuoni. Oh, Jack una glow. Katrina, what's up, man? What's happening? Onesmus? Kulala kama panga. It's fine. So ukipaka hivi ya nini?
I wouldn't
Ikienda kuna
say
shika tu.
hizo ni vitu tu watu wanajiekelea.
Tunajiwekelea hizo vitu. Kwa nasemanga hivyo maze. Ati which of the wanaongea juu ya the rashes zinakuanga kwa mapaja due to friction. How do you treat them? Unaona wale wanakuwa na black inner thighs. Yes. Anaitwa Rebecca Mutinda.
Due to friction, you can do scrubs and wear clothes that separate the thighs to avoid friction. Waliangusha kampuni ya Baika, lakini kama uko na thick thighs, please.
After tights.
Ama tu vai Baika.
Buy Baika. Yeah. Hata kusugwana. Leo nafika unashangaa, what's happening? What's happening to my thighs, man? Okay. Haya. Tushamaliza hiyo story ya hygiene. Now let's move into abortion. Yes, that is going to be our last point of conversation. Just before we talk about okay. Before wacha niulize ya mwisho ndio tuingie kwa story nyingine. Wanjiru Macharia, Aki Obinna, mimi kinyesha hutoa tudhundo hapo kando kwa mapaja na feel kujikuna. Hizo ndio signs za MP ama ni ugonjwa?
So during kunyesha ama before ama after?
Akinyesha tu hiyo period anakona tudhundo huku unamfanyia ile kitu.
So it will depend even on the quality of sanitary towel they are using.
Okay.
As I said, not every brand is friendly to the human skin.
Okay.
Yeah, and we've seen that even online, people are complaining.
True.
So it's high time she changed the
Try
brand.
changing your pads. Yeah. Then after you insist, see a doctor.
Yeah.
Na hii kukalia maji ya chumvi, Reggie Flavor anauliza hapa.
Kukalia maji ya chumvi, we do that for women post-delivery to enhance the healing, maybe if they got that episiotomy. Episiotomy ni ile kukatwa kuenhance mtoto kutoka if the opening is small, or they got tears, of course mtoto akitoka. You understand? Okay. Or maybe they have lacerations, maybe huwezi jua ametoa wapi lacerations, but it's a healing therapy. But if your genitalia is normal, haina cracks, haina anything, there is no need of you doing salty water.
So wale wanakalianga after fire.
Because they got lacerations, definitely. Kwa sababu
especially after Wajaluo. All right. Huyu sasa huyu anataka ICU. Huyu, this is an emergency case. So wacha tu niulize tena hii. Wanjiru Bashari amerudi na shida. Kuna mashida mob. Sema alafu mimi kinyesha manyoya zote zinatoka.
Manyoya?
Yes. Inaanza kung'oka. Inaisha nikimaliza inamea tena. So basically during a period she's Jordan, man.
And I will say still it's the product. Inamchoma kabisa mpaka
manyoya zinatoka.
Yes, you know the skin ikikuwa weak, of course.
Yeah.
Ita peel off.
Where?
Ama pia the duration anakaa na pads. Maybe ni mtu akukaa na pads kutoka asubuhi mpaka lunch time. Okay. Hiyo ni masaa ngapi? It's a lot of time.
Okay.
Yeah.
True story. What she said actually making a lot of sense. Consider changing your product. Historia tukinyesha pimples, manyoya zinapotea, unakuwa bald, kimaliza, they grow back. Tricky. But look on the good side. Aulipi waxing.
Aulipi waxing.
Hakuna waxing free of charge. So guys, after my periods, man, I'm going to be as smooth as a baby's booty. Nasala is asking, Obinna, my friend is asking, yeah, your friend, if it's okay to go down. By the way, is it healthy? Is it anything to go down on a show?
Those I would say it's personal preferences. Yeah, so if that is how you enjoy it, then, but make sure you're going down on something that is clean, well kept.
So para throat cancer.
Ama
happy.
Fungal. Whether the candidiasis, you can get it ya mdomo. Hata ya throat.
Kai. Semaji nimego down kwa ushore huwa nini bald alafu namuka hivi sachak mandevu zinaanza tu kuanguka. Unabaki kama mimi hivi. Faida ndevu nini? Najua aje kwani mimi ni dem.
Ungekuwa nazo ungekuwa naambia.
Okay, daktari, faida ndevu nini?
Sijui, sina.
Wanayote ni nini? Na
trap that.
Brother, your beard's a daddy. Unatumia ndevu mimi sasa kugotea hivi tena. Wenye unakamini na hizo ndevu karibu na mimi. Damn. That's what you've been doing. No wonder ziko sharp. I've been thinking they were just for looking nice. Daktari, umejua hiyo?
Nimejua leo.
Damn. Y'all are nasty. Umosh, umefuga ndevu? Korir? Is that what you've been using your ndevu for? Msichana wenyewe atajikuna. Pata sayo ndevu zako ni chafu. Na mwacha na UTI moja safi. Pata uko na homo. Hika, bagi kwa ndevu. Aki ume naribia. Si aiona ndevu the same again. You can't unsee it. Mimi ato ndevu ni ya kushika kufikiria.
Na si kuhate juu yako haiko. Oh, iko umeshave.
I wouldn't even use it for that purpose. Ndevu. Pata runi nishike nikifikiria. But it's fine, Chuck. Enjoy, my brother. If it makes her happy, anything for the ladies. But now, muzwanye pato. We pato. Usitumie nini hivyo. Just putting it out there. Nani mimi nako na ndevu hapa. By the way, kwa hii crew watu ndevu ni watu wawili. Ni Korir na Chuck. It's fine. Now, guys, it's enough. It's enough about. It's enough about the story for that hygiene. Let's switch. All right, but before we do that, let's talk about Gold Child Media Institute. I want you to join them. You get to learn what to do over here so you can get to do it beautifully. I'm talking about production at its best. January, we miss February, we miss March ndio hii. Are you also going to miss the March intake? Check out this video. Welcome to Gold Child Media Institute, where talent meets opportunity. This is the place where your media dreams come alive. And guess what? We've got something for everyone. Do you love the camera? We offer videography and photography classes. Action! Shoot! Take Jesus. Nimepiga nani picha. And for those who love music production, yes, we have the course. Mpaka wale wama chiki 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 anguka sound and graphic design. And trust me, this is just the start. We offer so much more. Over here at Gold Child, it's all practical learning, no boring theory. Basically, here at Gold Child Media Institute, we prepare you with the real skills for you to thrive in the real world.
At Gold Child, I feel like a pro already.
Enroll today by dialing the number on the screen and find us in Nairobi Development House. All right, I'm going to see you guys in class, so you better come through to Gold Child Media Institute or to join. Sometimes their students come through today, like today. They come through over here like today. We had a couple of them visit, so you can get to see practicality. All righty, now let's conclude with the matter by now talking abortion. We, amusheni yo nani, amushe wangwana. Magician ako wapi? Mwambie amushe wangwana. The magician is up next. Shell the magician. Ako next. Sasa kama umejua umependa mambo ya yeah, we're about to do magic next up. That one is we're getting more ready. We are winding up with Dr. Doreen in the building. We've just spoken about family planning. We've talked about hygiene. And now we want to talk about abortion. Abortion is a crime. Abortion is a crime. Is abortion a crime?
It depends on the context.
Okay.
Yes.
Hajiski na mimba.
That is not within the confines of the Constitution.
Okay.
If you go to Article 26(4), you will see what the Constitution allows in Kenya.
Okay.
So there are those conditions that every doctor will predetermine when a woman walks in. If your case is within that confine, then they will proceed. But if not, That's why we talk about pregnancy crisis counseling. This is someone, if it came into your mind, definitely, maybe you will do it. But through a group of sessions that you take in, a series of sessions of counseling, so that you can come into terms with the fact that you're pregnant, and maybe you can enroll for antenatal care and prepare for the coming baby.
Okay.
However, there are people who, if they have decided, they want it. We have so many quack doctors hiding behind Vios, Knini. You've heard of them. There are so many, even within Nairobi. Unfortunately, these women end up in the hands of such people. And it may not end up well. That is why we sensitize a lot on getting safe services, getting expert advice, because not everyone who wants an abortion is eligible for it. Yeah.
Okay.
Yeah.
Kunywa strong tea iko na majani mingi.
Hizo ndo witchcraft
Na imaliza
tunaongelea.
mtoto. Jasikia hiyo?
I know they talk about that, but
Mega Panadol 17.
Panadol is very toxic. They will just lose their lives instead of getting rid of the baby that they didn't want.
Pigwa ngumi kwa tumbo.
Those are crude methods.
Si wanasemanga, kwani nyinyi hamjaisikia?
Yeah, I bet it's because the laws have made it difficult for women to get it, which I understand. The Kenyan society is an African setup, and they have their own values and beliefs, and we cannot dispute the fact that they are there to govern the behaviors of the society. So the constitution is there to guide the doctors, and the doctors have the right prerequisite knowledge to be able to guide the women who are in need of the service. Yeah.
Okay. Ati kukunywa undiluted juice Napata kwencha ile konk.
No, let them not do that. It's not the end of life. Wewe ulipata mtoto wako wa kwanza ukiwa how old?
20.
20.
Yeah.
The mom?
I don't know.
Obinna, jamini. Na mulifikaje hapo kwa kupata mtoto kau?
Mimi ilikuwa first time yangu, hata nilikuwa na mtoto mwingine. Actually enda alinifunza.
Haukujua miaka yake?
Nope.
It was first time.
Yeah, mine is the first time.
So
so it was second time.
It was the first time, like.
Yes, mimi alikuwa ananifundisha sasa.
Lakini after so many sessions of kufunza.
Si of course, bado nilikuwa green.
Sai.
Ilikuwa like, okay, well, okay, it was good. That's good. I'm like, ooh.
But to be honest, you would have wanted to enjoy life better before becoming a father, right?
Yes.
And that is why we are talking about contraception.
Thank you.
Yeah.
Mimi hata watoto wote sio wangu.
Ni baraka.
Sijasema si baraka, nimesema tu watoto wote sio wangu. Ni mama wao.
Na vile tu anafanana wewe jamii.
Mambo ni mingi. Watu wakiishi pamoja ufanana.
Hakuna.
Nimeishi na watu tunafanana na mimi, lakini ni tu mama wao. Walikuja na mama zao. By the way, unajua kusema ukweli. Kusema ukweli. Mimi sina mtoto.
Uko na strangers kwa nyumba.
Walikuja na mama zao. Siku moja nakamkuambia ukweli ndio wapatia chai.
Tunajua ni jokes.
Yeah. The lady was 32 surely. Akuwa 32. Yeah, I think tulikuwa maybe age mates. I don't know, mali hapo. Okay. Why are we talking about the lady again? Focus. Let's come back over here. Tajui age ya baby mama. Mbona nijue age ya baby mama? Chako unajua age ya baby mama? Mtu wa mandevu leo. Yes, that's so true. Aya, mulete maswali za abortion. Mulete maswali za abortions ati Jake. Woi. There's a lady who, I think that time I was in high school or something. Tuliambiwa alienda kwa quack doctor. Then quack doctor akaingiza chuma huko chini. hakakoroga ati anabondabonda mtoto, ati akishabonda mtoto and then wanaanza kumchwero. Chwero ni ile kuscoop, nika kuscoop kind of. She lost her life.
Yeah, it happens.
And since that time, when I heard the story, I was just like, ugh. Abortion kidogo tricky. Yeah, where's that? Mtoto ata find a way. The minute you're pregnant somehow. Yeah, and today I was discussing with Melvin again on the story for abortion, and we were saying, let's talk pregnancy first. Because most of the time you find the man is not ready for the child, but the woman is ready. Sometimes they are both not ready, but the woman is just, nikipata ndapata, nisipopata. This is normally our analogy as men. I don't know about women. But dem kama hataki mimba yako, hoi, hatapata. Dem kama hataki mimba yako, hatapata. Akipata, either alikuwa tu zile za, okay, nikipata si mbaya, but I'm not ready, but well. Because kuna wale wanaume wanajaribingi aje, dem anasema, yuko gaidi, no, it's not gonna happen. So we're discussing with Melvin and we were like, we would really love it if the world will get to a place where before the lady decides, mimi ni kama, mimi nataka kushika mimba ya Obinna, because either time yangu inapita, ama he's the father figure that I would want, ama I would want his mbegu. Ladies get pregnant for different men for different reasons. Inafaa Obinna a consent. Would love. Do you think it will get there where sasa ni aje, Obinna, mimi nataka sasa, mimi nimeona na mimi niko zile, okay sawa, let's sign, ama mimi sidai. Yeah, because also there's a story that when it gets to abortion, the woman has the right to decide what she wants to do with her body, which is also true. It's her body, yes. But what's in her body is also part of my contribution. So I also have a say in my contribution. But when wanasemanga zile za, no, you're not the one who carried the child for the 9 months. And someone's like, no, me, I've decided to keep the baby, da. And the man is like, but I'm not ready to be a father. So what happens in that case? So we're just having different conversations around that area. What do you think as a professional?
So my take on that, I'm not a relationship expert, of course, but it all depends on your goals as partners, or when you get into a relationship, in our African setup, ama tuseme tu kikanairo, we don't take time to know each other before tuanze kufanya hizo vitu zenye hatufai kufanya until marriage.
Yeah.
So we get into excitement with each other and we forget the most important things when starting up a relationship. I would refer to the 3 stages of a woman's, the 3 stages of a woman. So the woman has 3 stages. There is the young girl who is below 21 years, like your girl now. Her main concerns are maybe or worries are about menstruation. They are afraid maybe akiwa na periods hawezi enda shule, maybe because akiamka atakuwa amesoil. They don't know the right product to use. They even don't know how having a menses feels like. You understand? Those are such kind of worries that an under 21-year-old woman will experience. At the same time, they are going through adolescence. They may want to develop relationships, and if not guided well, they may end up with unplanned pregnancies, unfortunately. If a 13-year-old girl is having her menses, definitely she is ovulating and she can get pregnant. So what is the need of that woman? This woman needs proper guidance. She's a woman, of course. She's a young girl, but a young woman. And she needs the proper guidance to overcome those adolescent forces. Unataka kuwa na boyfriend, you want to be recognized. They're also fighting self-esteem. Wameanza kugrow boobs, maybe classmates hawana boobs kubwa, they have hips. You understand? They're also fighting self-esteem issues, and most of them may get lost. They may get lost maybe into a premature relationship that might lead to a pregnancy. Obinna, have you ever asked yourself if your 13-year-old girl came to you and told you they have not had their periods for the last 2 months, And maybe when you get to the doctor, she's pregnant.
Let's talk about something else.
So that is a very sensitive area. And that is why, because this is the type of an eventualities that you would not want to have, you will need to sit down with your daughters and talk with them one-on-one. Usiogope. I know you're very free.
No, we've had those conversations.
Yeah.
We've had, but I normally say, I don't know what to do. It's the same way if my son comes to me and tells me that I'm gay. I don't know what to do. If my daughter comes to tell me that I'm pregnant, what to do?
So that is why we say parenting is not a
one-way street.
Yeah.
There's no like right way that this is the direction. So
yeah, sometimes you require prayers, you require counselors and all that.
So guys, what's funny? Okay, let me ask you, now that we're talking here, mtoto wa 13 year old anaweza kwa family planning?
Yes, they can. If you again go back to the Constitution, any woman of reproductive age has a right to access to health services. Reproductive age, any girl who is already having their periods, turns after 9 years. That is a woman of reproductive age. Yes. So they have the right to choose, regardless of if they
I will talk to the mother. Tumupige handbrake 5 years.
Apana, it has to be her choice. And if she
feels
she's sexually active, you know, nowadays, the kids are exposed to the internet. Huwezi jua na watching nini when you're not there.
That's what I'm telling you.
And friends in school, when you are mechanuka.
Nini munangorota hapo? Sharon ni nini? Ni mtoto wenyu? Daktari, talk to me, eh? He's my daughter. Forget about Akina Sharon. I will talk to the mother and I will talk to Brianna. We see what is possible. It's better to be safe than sorry.
We have services for such young girls.
Sawa, nitamleta mumcancel alafu tuongee alafu tuone. So that's better.
Is what is most important at that age.
Kuna mtu anaandika pa child abuse. Obinna no.
Yeah.
Sikia watu, yeah. Nini madaktari? Daktari ndiye anasema. Nini watu wanaongea as if I've said what I've said. We'll talk to the mother and her. Breathe. Yo, chill.
But let us not be blind to the fact that teenage pregnancies are on the rise. Yes.
Sikia, Joy. Joy, let me ask you. Today your 13-year-old daughter comes home and tells you she's pregnant. What do you do? No, forget about your daughter who's 19. I'm talking about when she was 13. She tells you she's pregnant. What happens?
Of course, as a mother, I'll be disappointed.
You'll be disappointed as a mother, eh? Then?
And then you pick it from there.
You pick it from there.
Yeah.
To where?
To where? Unamtrain venye atakuwa mama.
Anaongea hivyo juu ashafika 19.
Do you know the pressure of raising a child as a grown-up? Now think of a child raising a child.
Yeah, it's very stressful. It is very stressful.
This conversation is very complicated. Trust me, it's one of my greatest fears. I've thought about it. I've spoken to the girls about it. I've spoken to my son about it. I also speak to my son is 14. He's turning 14. And I always tell him, if you bring anybody here and tell me, maybe between 14 to 18, Dad, we are kona ball yangu, whatever. I always tell him, if anything like that happens, hey, you'll have to now man up. You are now a father. Mm-hmm. However, I'll be very disappointed. But now what do we do? Nitaruka huyo mtoto wenyewe. Hawezi ruka mtoto wenyewe. Because huyo mtoto probably parents wake pia watakuwa ameshamuunda. Sasa wanasema, twende, tupeleke kwa kina Liron. Then wanakuja wanakaa hapo sasa msichana, probably she's also 17 hapo. My son pia hapo 17, 18. Ako na mimba, parents hao pia mimi nimekaa hapo. So what happens? Nikanyage shingo au kijana nimalize. Ama turuke nimwambie mimi sitaki story. That means I will have to take responsibility of these other two individuals. The child and the mother. So what do? I prepare my son mapema so they know the consequences of. And it's not that, oh, nitakukanyaga, nitakuua. Maisha yako itakuwa imestop. You'll now start becoming a parent. Now, all the pressures you see me going through with your mothers and everything, now you will go through. So is that a decision you want to make? So I want them to make decisions when they sit. I don't like my children making decisions out of fear of dada ranichapa. I want them to make decisions out of consequences. They're like, if I get pregnant now, do I drop out of school? Will I still go back to school as a mother? Then do I start raising this child? Then how will I provide for this child? It's complicated. Different people, even in the comment section, watu wengi sana wako na nini mingi. We, mtoto ni mdogo, wachana na mtoto, nini. But remember, mtoto si wako. And if shit hits the fan, where does it go back to? Because now it means that child will be tortured psychologically.
True.
Because it's a child. Then now they have a child that they need to take care of. So I'm taking care of my child when my child is taking care of their child. Then I have to assure my child that everything is going to be fine, but I'm already disappointed and I'm hurt and I'm broken and I'm going through pain. But I have to stay strong for my child who's also hurt and broken and confused. Probably she was taken advantage of. Because most of the time, by the way, don't just think that it'll be a decision that your child will make. This is for every other person who's watching. It's not just some random boyfriend in school. Your kids could be molested. Maybe with an uncle or a houseboy or a shamba boy or a teacher or a doctor. The list is endless. Things happen.
True.
What do? Now you sit down and say, I wish I knew I could have done this. So it's a very complicated situation. Now Bri's a good girl. It's not about the child being a good person. Shit happens. True. Human beings are just terrible people or living creatures, and things happen. I always see the way people comment in their videos on YouTube, and you're like, these are children, you pedophile. And people comment such ways. So when you look at such things, you need to just prepare. So off camera and off everything, I'm going to look for you. I'm going to look for Brianna's mother. By the way, we had this conversation with Brianna's mother, I think, about a year ago, and we didn't conclude. Hey! Wait a minute. There are people who like burying their head in the sand.
True.
Mr. Kuskia, is happening.
That is the right time to talk about it.
Thank you.
Yeah.
I'll find the mother. We'll find you. We'll find a therapist. We'll sit down with Brianna. We see when Ada gets to the age, you'll have the same conversation. When Brianna gets to the age, you'll have the same conversation, and the next, and the next, and the next, and the next.
Yeah.
Also, we need to have the conversation with Chantel, Mama Chantel. When Rosie gets there, and the rest, we see whatever is going to happen. See, that's the best way.
It's true. And for any other person who has a teenage daughter or son, this is the stage of guidance.
Yes.
Yeah. They listen very well. If you talk to them, you're friendly with them, they'll see themselves past that stage.
Yeah.
And get into the next stage where hata akiamua kuzaa, it's okay. They can easily raise up a family by their own without even burdening their parents. Yeah.
14-year-old boy, vasectomy.
No.
Come on, man. Guys, think with me. Let's be open-minded, man. I'm just thinking. Not now. Daktari.
That is
Forget
it.
about Joy. She's a bit emotional. Talk to me.
You first. Then the 14.
No, I can take care of my kids. Mimi hata nizae 17. Sai ni saa 8 tuko hapa na bado tuko na guest wengine wawili. So mimi niko wera. Me I can take care hata nizae ngapi I'll take care of my people.
Ukiwa 14 years when you were not in a position of making your own decisions.
Daktari.
Mbona
unakuwa two-faced? Sasa kwa Brianna tunaweza mweka family planning lakini
because it is reversible. We have reversible options for women. But for this 14-year-old boy, why don't you talk about condoms?
Haimtoshi. 14.
Nani alikwambia imtoshi? Siku hizi kwa market kuna sizes zote.
Za watoto.
Tuko si hata kuna watu wakubwa pia.
Sasa hapa ndio I bury my head in the sun. Kuna watu wakubwa wanatembea na ni za watoto wewe.
Mimi nimesema.
Daktari. Mimi nimesema wapi? Sasa kusema kila mtu si mjaluo ni. Okay. So but unajua kuna vasectomy ile unaweka alafu na nini?
Hakuna reversible.
Doctor,
it is irreversible. Let them even mature well anatomically. Ndo hata daktari aweze kulocate the
I'm gonna lock that boy in the house, man. He's not going nowhere.
No, just talk to them.
I'm gonna talk to him.
Man on man.
I'm like, young man, come here, man. Let's talk. All right, where? Hey, story nanishtua.
But it's the reality.
I know, scary, but it's
So
the
you're in that
reality.
stage of parenting.
Yeah.
You understand? Even for women. Now, beyond 21 years, a woman is thinking about developing the career, starting a family, planning a family. Maybe I'm at the top of getting promoted at my workplace. Alafu tena uniambia I get pregnant. Maybe when I get pregnant, that opportunity inaweza nipita. So the needs shift. Unaanza kujielewa better. So this time you're worried about your daughter who is 13-year-old. Parenting responsibilities are there. We say even this is the stage in marriages where marriages mostly break. Juu wewe umefocus tu mind yako kwa watoto, unasahau mzee. Understand? So those are the stages that every woman goes to, even beyond 40 years, the third stage. Huyu anafikiria menopause ndio hiyo inakuja. You understand? Their children are already in campus. And mind you, a 45-year-old woman can also get pregnant. If the firstborn ako tuseme 25 years, if they gave birth at 20, alafu the idea of them getting pregnant, anasema sasa mimi nafaa kuwa naletewa mjukuu. So these are the women even who will opt for the permanent methods because they are done completely. Hawana 50-50 na izaongeza.
Anang'oa ovary.
Anakatwa tubes. Anatie tubes. Ovaries are there to maintain the female characteristics.
Na mwingine namjua ana ovary.
Maybe because of medical conditions. Maybe they had the cysts. You understand?
Yeah, by the way,
the
alikuwa
ovarian
medical
cysts.
situation, yeah.
Yeah. So there are conditions that may lead you to lose some parts of the organ, which is quite understandable. Even others have the whole womb excised, especially for instances where you had maybe cancer and it was only localized in the uterus. So you would opt to have the uterus removed other than have it and maybe the cancer spreads. You understand? So kuna situations zile tu, they are inevitable. And some of these problems, at 21-year-old haezi kuwa na problems ati cervical cancer nini. But at 40, that is where most women even get diagnosed with such conditions. So their need also changes.
Okay. I know what to do. I'm going to play this video for my kids. They'll watch this episode. Naambia kaini chini.
Utafilter some parts.
No, si unaeka hiyo party ya pregnancy tu uko mwisho.
Hapo.
So ana watch. No, but there's nothing that my kids don't know. We have conversations.
The teenage ones.
All of them. Kwanza Lola na think kama wewe.
Walai.
Unaonanga tu Lola hapo hivyo. Vitu amejua.
Akifika 13 uko na kazi.
No, at least her she's ahead of her time, so atajua even before. So hata by the time anafika 13 already, like she's smart. Yeah, she's a genius. So hata kazi yake itakuwa rahisi. Yeah. Nice. So let's ndawachezea tu hii video, nikishacheza ni pause, alafu niwaambie guys, so what do we do? Niangalie Brianna, niangalie Liron. Niambie decide. But I'll get professional to help me do that. Thank you for watching this one. Thank you for coming through.
Thank you.
Maswali mingi zinaendelea hapa. Hawa watu wanaweza kukupata wapi?
Nafanya kazi na Maristops, based at Samia Business Park, but we have very many branches within Nairobi.
Okay.
The contact that you can reach us is our toll-free number, 0800 720 005.
Okay.
You can WhatsApp through 0709 819 001. 0709 819 001. You will chat with professionals, and if you want a specific doctor, they will also link you up with them.
Okay.
Yes.
There you have it. All right, thank you so much for watching this particular episode. Nataka sasa kuimaliza sana mambo ya uchawi kidogo. Niulize huyo kama anaweza toa mimba ikiwa kwa tumbo. Afanye So Shell the magician is here. We're about to enjoy some magic. It's very safe. Yeah, usikue na wasiwasi. Usiende shikili Biblia ukianza kuwatch kipindi, even though I'm a little bit scared. So but kuna watu hapa watumia kama props. Mimi waani kunifanyia hizo vitu. Mimi ni baba ya watoto. Mimi niko na familia. Sasa tena afanya alafu backfire, alafu katai kureverse. Hapa watu hawajaza watafanyiwa. Katrina, Jackie Ogaga, Onesmus, Kevo, ule Mluya wa Busia, Omosh, Chak amenini. Kweni ready tuwatumia kama example kwa hii party ya waganga inakuja next. I'm seeing you guys in a short while with Shell the magician.